Call the St. Paul City Council to order. Roll call.
Tao.
Here.
Tolbert.
Here.
Yang.
Here.
Jalali.
Here.
Naker.
Here.
Prince.
Here.
Council President Brenmon.
Here.
7 present, no one absent.
Please stand and join Councilmember Prince as she leads us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you.
Thank you.
Consent agenda items 3 through 18 are before you for your consideration.
Should anything on our consent agenda be taken for separate consideration today? All right, seeing none, Mr. Tao moves consent agenda. Any discussion on that motion? Seeing none, roll call.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Naker.
Aye.
Prince.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The consent agenda is adopted. Item 19 is an update on the COVID-19 from Ramsey County Public Health.
And I believe Ms. Anderson is with us today. Welcome. Thank you for being here.
Thank you so much for having me, City Council. I'm happy to be here. I'm going to go ahead and share a brief PowerPoint, if I may. So, as in previous updates for you all, I'm going to start with just a couple of good notes. So many of you have heard the news over the past week or so. We've been chattering about boosters for recipients of both Johnson & Johnson Janssen as well as the Moderna vaccines. It looks like those are coming soon. The FDA had some robust discussion last Friday about approving those boosters. Next up, we will hear from the ACIP around any guidance they may have for prioritizing those booster doses to target populations. As you might imagine, some of the original recipients, specifically of the Moderna vaccine, were residents of long-term care facilities as well as healthcare workers. So we are excited for the opportunity to begin offering boosters to those residents who are at least 6 months out from their first 2-dose series, as well as prior recipients of Johnson & Johnson Janssen. And we are basically providing some training for our staff on how to give those doses, and we will begin to integrate those into our clinic in about 2 weeks' time, or excuse me, maybe a little bit less, around Halloween, let's just say. At the same time, we're also preparing to give pediatric doses of Pfizer for 5 to 11-year-olds. The trial data for those Pfizer doses for pediatric populations looks really, really good. So I know that our schools, our families, our teachers, our students are all excited to receive those doses, and we are very glad to be able to provide them. My last bit of good news, just a quick pitch. If you know any healthcare professionals who are interested in volunteering their time on the weekends or evenings to support some of those vaccine clinics, go ahead and send them to our Medical Reserve Corps webpage. This is a great opportunity for folks to have some additional exposure to their community, to be able to provide vaccine in a friendly environment at a local community center, for example. So we're always looking for new volunteers. And again, excited about all of these new audiences for vaccine. Glad that we'll be able to provide boosters, particularly to older populations in our community. Just briefly, some additional good news to share is that we have reached our initial 70% goal for all zip codes here in Ramsey County, 16 plus. 70% have received at least their first dose. That's excellent news. We are definitely seeing more interest in vaccine right now. I think there are a couple of items in play here. one, I think that we're seeing the incentive program, some impact. We're also certainly seeing the impact of employer requirements here, seeing numbers increase around that completed series marker. So love to see it. Again, among all residents who are eligible here in Ramsey County, 76% have received at least one dose. So some good news. And I would say, frankly, if you look at Ramsey County's case rate as well as our positivity, our efforts at vaccination are having an impact in terms of our case rate right now. We are still at an uncomfortably high rate of transmission in Ramsey County, as well as frankly, the rest of the state of Minnesota. But you do see the impact of vaccine on those numbers. Like I said, our positivity is around 5 to 6% each week. Our case rate is still something like 200 cases per 100,000 residents, so way too high. But I think vaccine is dampening those rates, and I'm glad to see that. So those are my notes in terms of the data and what's on the horizon for us. I'm sure that you all heard the news. I believe yesterday or the day before, Governor Walz did announce some additional mitigation activities. These are statewide activities, but they will have an impact here in Ramsey County as well as the city of St. Paul. Our National Guard has been placed on alert to provide staffing at long-term care facilities. That's the unfortunate reality when you still don't have, full requirements for a vaccine among staff, and again with how transmissible this Delta variant is, I think that unfortunately we do need those additional staffing components available for long-term care facilities as we move into the winter months. The other thing to be aware of is that we will see National Guard standing up some testing sites again outside of the metro. I believe I heard Hitchens today, Crookston. I will provide a list to this team after this meeting because I don't want to misspeak here. But those staff will serve those community testing sites. The demand for testing right now is very high, and as it should be, frankly. We have our students going back to school. We have folks heading back to the workplace. We want individuals to seek testing routinely, especially if they are unvaccinated, but also if they are vaccinated and were recently exposed or did some significant travel. Those individuals I would encourage to test as well. So Roy Wilkins has been pretty busy the past few times that I've been there. My understanding is that Governor Walz is also offering rapid antigen testing for free at some of those same sites, including the Roy Wilkins site in downtown St. Paul. So there'll be a PCR saliva option as well as a rapid antigen test. My assumption right now, and I haven't confirmed this, is that individuals who have symptoms will be directed to take the rapid antigen test, and that folks who do not have symptoms will take the PCR test. But either way, good to have a variety of testing options. I have also taken advantage of the test at home option from MDH. I will go ahead and share that link with you all as well after the meeting. But it's a great opportunity to have a test at home. Take it if you have any symptoms, and confirm for yourself before you're out and about that you do not have COVID-19.
Looks like Mr. Tolbert has a question before you move on.
Yeah, absolutely.
Yeah, thank you again for joining our council meeting. On this thing, the one thing I've noticed about testing is if for walk-in appointments, it's really difficult to find because of the subcontracting to the Walgreens and CVS where they need to be booked. And usually it's about 48 hours to be able to get an appointment there. Roy Wilkins is obviously an option, but it's closed on Fridays and Saturdays.
Yeah.
Leaves the airport, and just based on using the MDH site and trying to get there, and our site doesn't have it on there, but it makes it seem like the airport is a appointment necessary rather than walk-in, and then it points people to private tests.
Oh my.
Long story short, can we do some stress tests on on how users would use this to find locations, as well as what could we do to open up Roy Wilkins on Fridays and Saturdays. I know a lot of Saturday is probably the easiest day for parents who want to do weekly testing if they're going to do the walk-in option. Um, for a lot of parents that want the kids tested weekly. Is there any talk about opening it up on Friday and Saturday?
Thank you for the question, Council Member Tolbert. What I have heard so far is that they are actively looking for additional sites on the east side of St. Paul. I have requested some additional hours at Roy Wilkins. Obviously, just having a Sunday option is challenging for parents. I can advocate for that again. I think something else that would be valuable for us as a community of advocates is to continue to connect with the state and the Department of Health around expanding all the community testing sites for evening and weekend hours. If you take a look at, I think there are 7 sites in the metro overall. I believe only 2 of them have weekend hours. So there, this is clearly a need that the state is aware of. I mean, they are pushing for expansion of testing, but it feels like we're a little bit behind the 8 ball. So
can Ramsey County Public Health put resources into opening up weekend clinics? I noticed the 2 clinics on the Ramsey County website, they don't actually do testing on the weekend. Fine, through it doesn't really work. I've tried those numbers, but what are we doing to get clinics here? Or, I mean, quite frankly, I wish we were at the schools doing testing weekly, but I know that they pass out those rapid tests, fortunately, or at least they're going to start getting them. But what can Ramsey County do to help this up with our resources?
Yeah, so the Public Health Department can obtain select numbers of rapid antigen tests for settings where we know there is an outbreak. We do not have enough access to testing material or a laboratory environment that would allow us to ramp up our own testing capacity. We have shared that with the state again, and are hopeful that we will have access to additional antigen testing in the future, so that we could potentially do, for example, hand out some antigen tests at our vaccine clinics. So just so that folks have those on hand. We've certainly heard loud and clear from our school partners about the needs for testing as well as vaccine. I think that, despite the state's efforts at developing what I believe to be the most comprehensive testing program in the U.S., there are certainly some gaps there in terms of access. And I think even if we do send families home or send kiddos home with a at-home kit, it doesn't necessarily mean that they're going to use the kit. So I think we have a combination of solutions that we will have to work toward implementation. It includes, advocacy around testing resources for schools, for laboratory expansion, which is challenging right now. And then finally, figuring out how to support schools with health education and potentially, helping them frame some of their ARPA dollars to sustain work for kiddos around school health. That's where I'm directing my energy right now. I know our schools branch has been pretty active in terms of connecting with schools, helping our school health personnel understand how to use the tests that they do have. And then obviously, so as soon as we can, I mean, we're already providing vaccine at high schools, but when we have opportunities to provide vaccine to younger ages with parental consent, of course, we will be co-locating and make ourselves more accessible for vaccine.
Is there a way, one of the things I was wondering is schools, get uh, kids who might be exposed or have symptoms, is there a way to get them in like a fast lane line that we can connect them with? Do you think
Y- Yeah. I mean, I believe that's part of the planning that has been ongoing between Minnesota Department of Education and local school districts. I mean, that's part of the reason why we have these small caches of rapid antigen tests for school use. Because if someone is symptomatic, that test becomes very, very accurate, and it's an easy way to identify someone who needs, support and to stay home for a few days while they recover. So, yeah, I could follow up a little bit more with our school partners and see where the gaps are now. We're just I'm so excited to provide vaccine for those students and in that environment. But yeah, the testing gap is very clear.
Yeah, and the reason I agree, I think we all kind of got excited about the vaccine. And obviously, November is a big deal for these young folks who, unlike the people who are choosing to not get vaccinated in the rest of our community who qualify, they don't have that, they don't have that option as student or as young people. But what I've noticed is just the gaps in the schools, and I guess I falsely assumed that some of the stuff was worked out prior to the school year starting, but for young, I think about a young kid that might have, kids are sick all the time. So they're like, they might, is it that? And parents who, we should make it very simple for that parent to be able to get the kid tested so they can make the responsible choice on what to do for their child, because they obviously have work issue, work. And if there's a way that we can prioritize kids, especially because they're in rooms with 20 to 30 other kids every day, and there just seems to be gaps in the schools. And from what even on my block alone, talking to the different kids they're all at different schools, and seeing the gaps, it would be good for us to help the school district get some guidance on this.
Yeah. Yeah. I agree. I mean, I'll continue a little bit unless there are other questions, but I take what you're saying to heart, and I think I will connect with our school branch director as well as some colleagues at Minnesota Department of Ed and see if there is a way for public health to step in and be a better partner along with healthcare and in coordination with school nurses. We need to be doing as much as we can for those kids so they can stay in school. The other bit of information I just wanted to share is Governor Walz's decision to increase access to this emergency staffing pool. I mean, I think what that says to me is how challenged our hospitals are at this point. And I'm sure, again, you've heard news around, what staffed beds look like, particularly in rural areas of Minnesota. It's challenging to treat new patients when we have a variety of patients with long-term needs who are in those hospital beds. So it looks like there is a transition happening to open up additional beds at DHS-run facilities so that hospitals can utilize more of their space internally to support patients with acute needs, whether COVID or otherwise. The other point I wanted to mention here in St. Paul, I think this was about a week ago, the state did go ahead and open up a clinic for what's called monoclonal antibody infusion treatments. So this is a treatment that does greatly reduce individuals' likelihood of hospitalization or death after they have tested positive for COVID-19. Within the metro, my understanding is there just was not a lot of access to this particular treatment, even though it's free of charge, So the state went ahead and leverage some existing healthcare contracts to establish a clinic in St. Paul. Now, the eligibility for this, just FYI, individuals need to test positive, of course. Symptoms have to have started less than 10 days ago. They cannot currently be hospitalized. Those persons would be a good candidate for potential treatment. I actually know someone who took advantage of the infusion clinic, and it did support their recovery, frankly. The other persons who are eligible are individuals who have a known exposure and are not fully vaccinated, and again, have a weakened immune system, which would therefore make them more likely to later become hospitalized or have severe outcomes from COVID-19. So this is brand new. You know, I mean, it's been out for about a week now, but I would certainly recommend if you know someone who is in that situation, calling the COVID public hotline and connecting with them about this resource, which could be available to you. And finally, the last piece of information I wanted to share, and again, I believe this news just came out yesterday, but Governor Walz is clearly very interested in getting those 12 to 17-year-olds fully vaccinated. So they are opening up a new incentive program for 12 to 17-year-olds. It is a $200 Visa gift card. You have to initiate your first dose, I believe, between yesterday and November 30th, and then it's up to $200, so $100 per dose. The other cool thing, I think, Minnesota's again in that age, Minnesotans ages 12 to 17 who have completed their vaccine series, no matter when, if it occurred anytime this year, they can enter to win potentially a college scholarship. So there'll be 5 different drawings. I believe this is being organized by the Minnesota, the lottery here in Minnesota. You know, go to the college of your choice, any public or private institution. Both of those programs, I included the URL here, but really highly Googleable, just so you know. Students and their families would need to go ahead and register online, and then you would receive the gift cards after you complete the registration. Or you know, you enter. You can do both. Enter the lottery at the same time. We're actually stacking those incentives with the $50 gift cards that we're offering at our clinic. So if you go to a Ramsey County clinical site, you'll get your $50 right away, and then you can go ahead and register, and you'll still be eligible for all the other opportunities listed on the screen. So one more plug for our local clinics, just so you guys are aware, and all of our residents too. Quick update on the numbers. We have, I believe since December 29th, we've given a little bit more than 57,000 vaccines at our clinics, which is just an awesome number to be able to share with you all. Clinics are large and small. You will see us at Oxford Community Center. You will also see us at a local homeless shelter. So we have gone to a lot of places across St. Paul and Ramsey County. This past week, our numbers, you know, definitely have been a little slower over the past couple of weeks. So we've been kind of between the 100 dose a week and the 300 dose a week kind of marker for a while now. We do anticipate that those doses will kick up again with the inclusion of boosters as well as a pediatric vaccine option. Last week, we were at our big 3, Consulate of Mexico, Arlington Hills, Oxford Community Center, and then we also responded to a couple of requests from community partners for a vaccine in their settings, and we will be doing the same this coming week. We're very focused right now on making sure that individuals who are receiving services at local homeless shelters are fully vaccinated as we head into the winter months. We know those congregate settings can be a pretty dangerous place if you are not fully vaccinated, frankly. So you can check out our website for more on that. Something else to be aware of is that we do offer, if you have a friend or a family member who is homebound and cannot come to a clinic, you can call our voicemail box, leave a message, we'll call you back, and we'll schedule an appointment for your homebound person, vaccine of their choice. We do that every Wednesday. So happy to come out to your home and support you in getting a full series of the COVID-19 vaccine. That is what I have for you right now. I am happy to stop sharing my screen and just take questions. So thank you guys for your time today.
Are there any remaining questions for Ms. Anderson? Mr. Tolbert.
Yeah, are you guys seeing results from vaccine requirements by employers?
You know, it's hard to say, but I think it is impacting our completion rates. So for a while, we would have just this weird lag in completed series. You know, a couple hundred people here and there. But I do think that having the requirement in place is encouraging individuals, you know, they're getting it done. We have implemented a survey at a couple of our big vaccine clinics just to assess why people are getting their shot. And I think that the incentive is listed as an option as well as employer requirements. So we'll have a little bit of a snapshot of detail there, and I'd be happy to share out at the next, if I am asked to present here again. So, yeah.
And from a public health perspective, would you recommend that employers have vaccine requirements?
You know, what I will say is that if I were an employer and I was thinking about the health and wellness of all my employees, I would absolutely mandate vaccine at this time. We have loads of data to demonstrate how safe these vaccines are and how unlikely it is that someone who is fully vaccinated will have the severe outcomes that others could have. If you take a look, I think MDH just put out some information today on their website around breakthrough cases among hospitalization and mortality rates among folks who were fully vaccinated versus those who were not vaccinated. And the data is really telling. There's a lot of cost for the employee themselves in not being vaccinated.
Ms. Anderson, or did you have a follow-up, Chris? I'm sorry.
No, I just wanted to thank you for coming and thank you for all your work on this and your department's work.
I'm really grateful that we've had these check-ins. It's been nice to stay caught up with where we're at and the up-to-date information. I'll just say, parochially speaking, looking at your list, I can't help but notice that the North End is missed again and again and again in terms of a site. And I know that Washington Tech has been a location for vaccinations in the past. The North End is lacking what many other neighborhoods have, and that is a community center in which to do these testing. And we're working hard on that on our end in St. Paul. But it really is a neighborhood that is predominantly young people, 65% under the age of 35 and a full 35% under the age of 17. And so I think it's important that we serve that community and intentionally. And there are lots of churches and institutions that I know would be happy to partner. And if there's any way that I can help connect you with places, Hmong Elder Center or the St. Bernard's Church or et cetera, I'm happy to do that. But I know that it's hard when there's not an obvious partner there to do the work, but the need is so great. And so I want to encourage us to sometimes go the extra mile with trying to find unusual off the beaten path locations to do this work, because we need to do it in all parts of the neighborhood. And I know I know that you do and you try, but any way I can help deliver services to that area, I would be happy to do.
Thank you, Councilmember Brown, and I will be back in touch with you about the North End specifically. So thank you for that.
Thank you. All right. And again, thank you so much for your report here today and for your hard work in this very important matter. We really appreciate you. Thanks. All right.
Item 20 is Resolution 21-1438, authorizing the city to transfer a total of $902,255 in CDBG CV award funds to a specific account for COVID-related spending activities. This item was laid over from October 6th.
All right, and this item was laid over, I think, for 2 weeks because we were trying to avoid having it at the council meeting in the wind. I changed it to in the wind. I know, so there was a request for layover. Our questions answered. I see Mr. McCarthy put his camera on, so I'm assuming Ms. Naker, thanks.
Thanks, Council President. I believe that we laid this over for 2 weeks in order to give staff time to come back to us and give us a fuller description of how Keystone was chosen and what the verification process was. So I think Mr. McCarthy is here to talk about that.
Mr. McCarthy.
Yeah, thanks, council members. John McCarthy from OFS. I wanted to give that timeline and process that ultimately ended up with the CDBG CV recommendations that we made to you over the last few months. So back in mid-2020, the city was awarded 2 different allocations of federal funding to respond to the COVID emergency, CARES dollars, and a special allocation of Community Development Block Grant, or CDBG funding, dedicated specifically to COVID response. In July, a city staff created an application process to allow departments to submit proposals for those 2 funding streams. And then a team of grant, finance, and legal experts across city departments used a set of criteria to score those proposals. In addition to this review, the CDBG projects had to go through a second round of eligibility review. Normally, CDBG dollars come with strict eligibility requirements around, mostly around benefits to low and moderate income residents. But in addition to those requirements, this pot of funding also had to be clearly tied to the response to the COVID pandemic. And then all of this review and screening work happened under immense deadline pressure. The CARES funding had to be fully spent by November 15th of 2020, and we needed to have a consolidated plan for the CDBG dollars approved by HUD by November 20th. So once that scoring and eligibility review was finalized, the staff team presented a resolution with recommendations on how to allocate the CDBG CV funding on January 27th of 2021. The council had requested that we strike one of the projects from that recommended list, and doing this meant that there were additional funds remaining to allocate. Those funds had to be in the public facilities HUD category in order for us to avoid a substantial amendment to the HUD consolidated plan. So in February of 2021, PED staff began working with Keystone on their community food site proposal. After initial review, staff determined that it could be a fit for the remaining CDBG CV funding. So in March, Keystone submitted that same application that city departments had used to apply for this funding. This proposal went through the same level of review as other applications did, including the HUD required screening, like risk rating and environmental review. And then city staff determined that this project was a strong fit for the remaining balance of CDBG CV funds for several key reasons. It could meet the eligibility rules to provide service to low and moderate income residents. It was a clear and direct response to the COVID pandemic. And importantly, it is a public facilities project, which would mean that we would not have to amend the consolidated plan that we had already had approved by HUD. So now that staff has completed all of that due diligence work, the Keystone project is here in front of you for approval this afternoon. But before that review, I want to address a few of the questions and concerns that came up with the council when you last discussed this item a few weeks ago. There were several questions about process and due diligence. So I want to stress that, city staff subjected this proposal to the same high level of scrutiny that we did with all the rest of the CDBG proposals. And also because of the strict eligibility requirements around CDBG dollars, the city does not put these funds out for RFP. Rather, we only work with a few select organizations that we've determined can meet the eligibility and spend down requirements associated with CDBG. Ultimately, the city is on the hook with HUD if a sub-grantee misses any of these requirements, and we could actually be in a situation where we have to return the money to HUD. The process in screening was robust. I think where staff may have missed the mark was communication with the council and administration on CDBG CV projects. Based on the questions that you all had at the last meeting, I think ideally you would have had ongoing updates that staff was working with Keystone on this proposal. I think in the minds of the folks who are working on this project, including myself, we felt it was such a great fit for the funding and the needs of our community that we plowed straight ahead with the work. And like I said, could have ideally done some additional check-ins with you all. And with that, I'm happy to take any questions that you might have.
Thank you, Mr. McCarthy. And thanks for the layover request from Ms. Naker for the extended period of time so we could get a thorough answer. I know that what we heard last week was not thorough, and this does help fill in some of those gaps. Ms. Naker.
Thanks, Council President. And yes, I want to thank you as well, Director McCarthy. And given this information, I am planning to vote in support of this project moving forward today. And I want to be clear that I think the world of Keystone, and I think this project is absolutely deserving and necessary. My questions 2 weeks ago were because I also feel really accountable for telling my constituents how we've decided how these dollars are spent. Every public dollar, but especially 900,000 of them. So I appreciate your clarification of the vetting that went on, and I do agree with you, and I appreciate the reflection that you did on communication. I think not just with us as council members early on in the process, but also with community partners as well, because I think we're going to have a lot more of these federal dollars coming through, and we want to make sure we're transparent about the criteria we're using and the guidelines we're under, and give everybody the opportunity to know about them and to apply if they're eligible. So thank you.
Thank you, Ms. Naker. I see Ms. Jalali, Mr. Tao, and Ms. Prince have hands up. So let's start with Ms. Jalali.
I was just going to speak in support of Keystone and to appreciate the additional information given, but I'm the sponsoring council person, so I can wait till the end if you want, just because other folks may have questions or comments. So if it's cool with you, I'll just come back to me after.
All right, we'll put you in the closer position. Mr. Tao, then Ms. Prince.
Thank you, Council President. I'm going to speak in favor of this item. From 2000 to 2007, I served as the Keystone IT and Facility Director, and have since then not worked with the organization other than as a council member in my capacity. And I'm speaking firsthand that it's a solid organization with good integrity and very intentional about serving the needy in our community. It's one of the organizations that would I bring my kids to go and volunteer at the food shelves and things like that. And so I think they continue to do the hard work and being in the front line and serving those that we need in the community. And so based on just my past experience with their integrity, working in our community, making St. Paul better, and also the facts that Director McCarthy has pointed out, I'll be supporting this item.
Thank you, Mr. Tao. Ms. Prince.
Thank you, Council President Brennan. And I certainly agree that Keystone is a worthy and appropriate recipient of this funding. My concerns have been about the lack of communication from the administration, and actually, not to belabor it, but on any number of issues relating to the availability of federal money and our working together as the mayor and the council more collaboratively to determine how to select priorities for that money. I appreciate Mr. McCarthy's report. And I would say, I had an opportunity to speak to Mr. McCarthy, and I believe that at the point that the council passed on a recommendation in November of 2020 for the use of that $900,000, it would have been appropriate as soon as a selection was made, which it sounds like was sometime in the early spring, to work with Keystone. I think that should have come back to us at that point. It's a year later since that last resolution on how we were going to spend the balance of the CARES Act funding. And I hope that we will be able to characterize our relationships about this federal money with more communication, not less, as we move forward. So I will vote in support of this today, but I definitely need us to not end up here again.
Great. Thank you, Ms. Prince. Ms. Jalali.
Thank you, Director McCarthy, and I appreciate our colleagues' support on this. I just want to speak to the neighborhood Keystone is relocating to, and it'll be right down the University Avenue corridor, near the Midway Griggs building, the Midway YMCA, the Fairview University intersection, and not too far from the Spruce Tree Snelling building, and just a part of our community that has seen a lot of challenges in the pandemic and also been impacted additionally by civil unrest and some of the kind of scarier just crime trends like pandemic crime that we've been kind of learning about and tracking in the news that's happening nationally is also happening locally. And I think that's important to talk about because a community safety strategy is about providing for people. And that means making sure they have food. That means helping neighbors have something to plug into, like volunteering at and helping a community hub and resource like this. That's more people on the street activation, less chance for crimes of opportunity. That's just meeting that blend of needs that creates a neighborhood that feels connected, where people get access to stuff that they just tangibly need to live their lives, and where we know each other better. And I think that's all part of the vision for the Midway that I'm working hard with partners to be supporting, and a long transit investment too. So I couldn't be happier that this is able to happen. I really appreciate the chance to talk through the process questions and hope to continue supporting this project. And I do appreciate Councilmember support of it as well. I believe it will serve many people across our city, not just the immediate neighborhood it's located in, but I did want to speak to that as well, because it's, to me, part of the context and some bigger picture values, things that we're working to advance. Thank you.
Thank you, Ms. Jalali. And seconding a lot of what you said, I'm going to be voting in support of this. And I probably feel a little bit more in the loop because it's something that I connected the dots with early after we had passed on one of the projects that had been recommended, and it just seemed like such an obvious match given the innovation and leadership coming out of Keystone and the clear connection to COVID. But I do really do agree about the council's ongoing request to be brought along on the journey, so that when we come time to vote, we don't feel like we're just learning about something for the first time. So what I know, compared to what maybe others know, is different. And so I do want to second that part. And then also just really lift up Mary McEwen, who's leading Keystone in this new normal and just doing a phenomenal bang-up job. And I'm just really happy to support her and her work and the important work of Keystone Community. So I will be voting in support as well. Is it Mr. Tolbert?
I just want to, I'm going to be supporting this. I think Keystone does great work, especially the Meals on Wheels program. But I'll put a shout out. I suspect Keystone would be happy if we did this, but they rely on volunteers in a lot of ways. So just a reminder that people can volunteer, and I suspect they'll need more volunteers as their services expand. So I'll just put that out there.
Yeah, it's a good reminder. All right, any further discussion on the motion from Ms. Jalali? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The resolution is adopted. Item 21, Resolution Public Hearing 21-225, ratifying the assessment for the Griggs Sheffer Area Paving and Lighting Project constructed as part of the 2020 St. Paul Street Paving Program.
Mr. Tolbert.
Yeah, I'm just going to make a motion to lay this over for one more week.
All right, there's a motion from Mr. Tolbert to lay this item over for 1 week. Any discussion on the motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The item is laid over to October 27th. Was that a continuation of the public hearing, or did you want that closed?
We can keep it open. It's
Okay.
fine. You believe it.
Item 22, Resolution Public Hearing 21-267, accepting funds from the Great River Passage Conservancy in the amount of $200,000 for use on the River Balcony Schematic Design Project, amending the financing and spending plan, and approving budget reallocation of Great River Passage legacy funds to the River Balcony Schematic Design Project in the amount of $55,000.
All right, and this item is held, public hearing has been held virtually. So Ms. Nager would move to close the public hearing and approve. Is there discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 23 is Resolution Public Hearing 21-271, ratifying the assessments for benefits, costs, and expenses for the Grand Snelling parking lot operation and maintenance costs for 2022.
All right, and this item, public hearing has been held virtually. As such, Mr. Tolbert would move to close the public hearing and approve. Is there discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert, Councilmember Tolbert,
Yes.
excuse me, Yang,
Aye.
Jalali,
Aye.
Maker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 24 is Resolution Public Hearing 21-272, ratifying the assessment for benefits, costs, and expenses for the 7th Place Mall operation and maintenance costs for 2020.
All right, and this public hearing has been held virtually. As such, Ms. Naker would move to close the public hearing and approve. Any discussion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 25 is Resolution Public Hearing 21-279, amending the financing and spending budget in the Department of Parks and Recreation in the amount of $22,693 to reflect grant funds received from the Ramsey County Soil and Water Conservation District through Minnesota Board of Water and Soil Resources for the Como Transportation Improvements, Como Pavilion, and Golf Course Parking Lot Construction Project.
The winner. So this item has had a public hearing virtually. As such, Ms. Jalali would move to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 26, Resolution Public Hearing 21-280, amending the finance and spending budget in the Department of Parks and Recreation in the amount of $25,000 to reflect grant funds received from the IA O'Shaughnessy Foundation from the grant holder's fiscal agent, Minnesota Landmark, for the Rice Park Revitalization Project.
All right, and this public hearing has been held virtually. As such, Ms. Naker would move to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 27, resolution public hearing 21-281, amending the financing and spending plan of the Department of Parks and Recreation in the amount of $150,000 for funds granted from the DNR's 2021 Local Trail Connections Grant Program, and also increasing by $80,000 allocated from the Public Works 880 funds for the Wabash Avenue Trail Spur Project.
And this public hearing's been held online. As such, Ms. Jalali would move to close the public hearing and approve. Any discussion? Seeing none, roll call.
Tal,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 28, resolution public hearing 21-283, accepting funds from the Great River Passage Conservancy in the amount of $475,000 for use on the River Learning Center schematic design project.
Ms. Prince, do you have a hand up on this item?
Yes, I do. And I'm sorry, I just realized this was here. When it came up among our bonding priorities, I realized I have not seen anything on this project. I think it's been a while since we've talked about it. And I wonder if it would be possible to lay it over 1 week. I take responsibility for not being prepared today. But I think it would be great to know more about it, or even have a staff report today. The attachment to the resolution is only a budget document and not any kind of a description of the project or anything like that. It's a large amount, and I just am not prepared to vote.
You're not prepared to vote to accept the grant funds?
Well, it's from the Great River Conservancy, which there are definitely a lot of other projects that are in line for that funding. So I guess that is my issue here. Just that I just would like to know more about this project, and I can just abstain if it's not appropriate to get a staff report or something.
It's always appropriate to request a staff report. I was just trying to understand what was the objection here. So is there, do we have a staff available to give us staff report on this item, or should we I'm looking, I don't know who that would be. So I'm just kind of looking at the attendees list. Is that you, Mr. Sawyer, or should we lay this matter over? Mr. Tolbert.
I mean, just from a practical standpoint, it's us accepting money from a conservancy, so we don't even have authority to prioritize how they want. I mean, so I'm not quite sure what, even if there was an objection to how they prioritized, I don't know what we would have to change that, but that's just my 2 cents. I think we should accept the money, but that's my 2 cents.
And I would just say I'm be inclined to vote as well. And if we'd like to report on the Great River Passage or River Learning Center, well, certainly we can get that. But it looks like Mr. Meyer has popped up. Mr. Meyer.
Yeah, thank you, Council President Brennan. Councilmember Prince, so this is just accepting the funds from the Passage Conservancy, and we would be initiating the RFP process in the next few weeks. So we can circle back with you and make sure that we kind of give a full project report, and with the rest of the council too, to kind of make sure you're clued in on next steps. And the Great River Passage Conservancy is actually going to be leading the kind of schematic design effort, and our staff is also involved. So we can make sure that we can kind of give you a more full report and status update on where that stands in the coming weeks.
Thank you.
So, Mr. Meyer, you said a 1 week layover is fine, and you'll get back to us next week with a report. Okay. All right, so there's a motion for a 1 week layover from Ms. Prince. Any further discussion on that motion? And I'm going to support the 1 week layover, but these are things I wish that we were ready to vote on today. They should be accepting money is great. So, but I will support your layover because I want you to feel comfortable enough to vote. Any other discussion? Seeing none, roll call.
Tao,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is continued to October 27th. Item 29, resolution public hearing 21-284, approving the application of Minnesota United FC for 2 sound level variances in order to present amplified sound on October 23rd and October 26th within the street and beer garden area outside of Allianz Field, 400 Snelling Avenue North.
And this public hearing has been held virtually. I am noticing that the women's national team is playing South Korea as one of the games. That was pretty cool. So public hearing's been held virtually. So Mr. Tao would move approval. Any discussion on the motion? Seeing none, roll call.
Tao,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 30, resolution public hearing 21-289, approving the application of Anderson Race Management for a sound level variance in order to present amplified sound on November 6, 2021 at Harriet Island, 200 Dr. Justice O'Hage Boulevard.
All right, and this public hearing has been held virtually. As such, Ms. Naker would move to close the public hearing and approve. Any discussion on the motion? Seeing none, roll call.
Tao,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 31, resolution public hearing 21-291, approving the application of Allianz Field for a sound level variance in order to present live amplified sound for the Polar Plunge at Allianz Field on October 30th outside of Allianz Field, 400 Snelling Avenue North.
What? All right, this public hearing has been held virtually for the Polar Plunge at Allianz Field, which I have no intention of participating in. And as such, Mr. Tom moves to close the public hearing and approve. Any discussion on that motion or any takers? I don't even know what it is.
Cold thinking about it now. I'm cold. Let's vote.
Seeing none, roll call.
Tao,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 32, resolution public hearing 21-285, amending the financing and spending plans of the Department of Parks and Recreation in the amount of $18 million to reflect bond issued proceeds received from the Port Authority of the city for the EAB capital project.
All right, and we've discussed this item many times. I would move to close a public hearing and approve. Is there any discussion on this topic? Seeing none, roll call.
Tao,
Aye.
Tobert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 33, resolution public hearing 21-286, amending the financing and spending plan of the Department of Parks and Recreation amount of $212,083 to reflect funds received from the Lower Phelan Creek project for the Wakantipi project.
All right, and so this item has held public hearing virtually, and as such, Ms. Prince would move to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenman.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 34, resolution public hearing 21-294, amending the financing and spending plans in the fire department in the amount of $1,388.75 for the Minnesota Task Force team reimbursement from the city of Edina.
This public hearing's been held virtually. As such, Ms. Jalali moves to close the public hearing and approve. Any discussion about taking money from the city of Edina? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenman.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 35, resolution public hearing 21-296, approving a petition by Ryan Companies to vacate and divert city parkland for private stormwater improvements.
And Mr. Tolbert.
Motion to close hearing and approve.
Mr. Tolbert moves to close the public hearing and approve. Any discussion on this item? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenman.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 36, ordinance 21-29, amending chapter 324 of the legislative code in order to create separate licenses for tobacco products shops and tobacco shops to restrict pricing, discounts, or coupons, and to create a distance requirement between establishments licensed to sell tobacco.
All right, and this item, we had a council report, not a staff report, 2 weeks ago, and laid the matter over for 2 weeks. I think we had initially hoped that we would have this public hearing in our council chambers when we set this date, but yet we are not back, and so this public hearing has been held virtually. I do want to say that on this item, compared to others, we had quite a bit of input from people who were largely in support. There was indeed some folks who were in opposition. And I did notice a theme in some of the letters that were received in opposition. And I just wanted to make one clarifying point that some of the writers claimed that by raising the minimum price to $10 a pack, that we would ultimately the price of cigarettes and chewing tobacco would be like $15 or $16 because of the state tobacco tax. And that isn't correct. The minimum price is $10. The tobacco tax that's collected by the state of Minnesota is not collected at the point of sale, but rather by the wholesaler. So it's not part of the price that we'll be regulating at this point. The tobacco tax is already paid on the cigarettes or the chew when it reaches the retailer. There is sales tax, and so with a minimum price of $10, it might go up a few pennies of sales tax, but it is not $5 or $6 as some folks had said in their letters. And just a also point of clarification that the average price of cigarettes is actually close to $10 right now. Some brands, the price will shift up a little bit more than others, but it isn't the $10 isn't a far deviation from the price currently. So I just wanted to make those clarifications and just thank people who contacted us on both sides of this issue. I think that over time, I know I've talked to some of my colleagues about this, and just the work of Answer and their steady plodding pace, recognizing that big change like this takes time and patience and takes bringing people along, and they do a really good job of that. And I was, understanding the concerns of retailers, wondering what they were going to do if people weren't coming in to buy menthol cigarettes or et cetera from their stores. And the more I've come along with Answer, the more I believe, and I've heard Councilmember Yang say this, is that I'm just not on board with using something that we know kills people and is highly addictive as a way to lure people into your store. And so I think it's time for retailers to find other ways to lure people in. I've said this a few times. Get me a good samosa, get me some pizza, get me some bubble tea, I'll get in there. But it's time that we find another way to bring people in the door, because cigarettes kill people. They're highly addictive, and they do not add value to our community in any way. So we do not vote on this today, but it's as we have our public hearing here today, I do want to make that statement. Mr. Tolbert.
Yeah, I just want to add on to that. I think what you said is exactly right. And the other thing, just for perspective, I don't think, and we're still not there yet, but I don't think we've seen any other public health successes like we have with smoking in the past decade, particularly. I'm on this council, I think I'm about middle age, but back in the day, everyone smoked. People smoked all the time. I can count on one hand now the number of people I know who smoke, and that's a huge victory. And I know a lot of businesses have written in about this, but smoking is dangerous. We know how extremely dangerous it is and how extremely addictive it is. It is so addictive and so dangerous for people. And I think one of the best things that we've done as a society, and it's because of laws like this, not just this law, but we've passed many laws, and people like Jeannie Weigum have led this at the state level and at cities and the entire group that works with them for years. But it's because of these laws that public health changes has changed. And I just want to give a tip of the hat to the group that continues to push us on this and say it's working. These laws and these things that make it less attractive, particularly for young, because if people aren't smoking early, they're probably not going to start. And most of us who have smoked in our life started at about 14, 15, or 16. And it's really hard to quit. So we got to continue doing these laws. Thank you. I'll be supporting it.
Thank you, Mr. Tolbert. Ms. Prince.
I want to thank my colleagues and Council President Brenmo, you in particular, for moving this particular ordinance forward at this point. I couldn't agree with you more that that a business model that's based on selling controlled substances is subjecting itself to all manner of regulation. And at the point that the state of Minnesota settled with the tobacco companies over their disgraceful, illegal, and terrible conspiratorial practices of hurting the public, it should have been clear that it's a risky business. I also agree with you both that the Association for Non-Smokers Minnesota is not only bringing forward really good and important regulation that is keeping people healthier, but they are building a coalition for this work, so that I know when we pass the menthol ordinance, one of the things that I felt so strongly about is this isn't the council deciding to do something. This is a coalition of our community organizations, of youth, of the religious community, business, the healthcare community that is coming to us and asking us to respect this good public policy. So I'm really pleased that this is before us. I appreciate the leadership that you have all shown, and I will look forward to voting in support of it.
Thank you, Ms. Prince. All right. I will move to close the public hearing and lay the matter over for 1 week. Roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, none opposed. The public hearing is closed and the ordinance is laid over to October 27th for final adoption. Item 37, ordinance 21-37, granting the application of the Housing and Redevelopment Authority to rezone 231 Front Avenue from B2 and T2 and amending legislative code section 60.303 to reflect the change.
And this public hearing has been held virtually. And as such, I would move to close the public hearing and lay the matter over for 1 week. Any discussion? Roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the ordinance is laid over to October 27th for final adoption. Item 38, ordinance 21-40, granting the application of Ava Mohammed to rezone the property at 576 Lexington Parkway North from RT1 to family residential to RM2 multifamily residential and amending chapter 60 of the legislative code pertaining to the zoning map.
All right, and this ordinance has been held public hearing virtually. As such, Mr. Tao moves to close the public hearing and lay the matter over for 1 week.
Council
Looking at you,
President,
Sherry.
is there
Oh, I'm sorry.
staff report?
Thank you. Thank you. Mr. Tao, we had not requested a staff report last week at the council meeting because of the AV limitations. Do you need a staff report on this item today, or would you just like to accept the public hearing and close the matter for layover? Mr. Tao, I believe you're on mute.
Sorry about that. I
That's
thought
all right.
that was only a Councilmember Prince issue here. Just kidding.
Thank you.
Kidding. I recognize it. Let's close the public hearing and approve.
All right, so Mr. Tao moves to close the public hearing and lay the matter over for 1 week. Any discussion on his motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the ordinance is laid over to October 27th for final adoption. The legislative hearing officer recommends adoption of the following resolutions as no objections to these recommendations were received. Item 40, RLH VO 21-40, 1177 4th Street East, and item 43, RLH RR 21-63, 120 Winter Street. And again, the motion is to adopt these items.
So moved by Ms. Prince. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Prince,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed, and the resolutions are adopted. For the following items, no objection to the legislative hearing officer's amended recommendation was received, and therefore she recommends amendment and adoption of item 41, RLH TA 21-259, 976 Rose Avenue East. And again, the motion is to amend and adopt.
All right, so moved by Ms. Yang. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Baker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no opposed. The public hearing is closed and the resolution is adopted as amended. For the following item, the legislative hearing officer's recommendation is to continue the public hearing to October 27th. Item 39, RLH BBR 21-62, 936 Duchess Street. And the motion is to continue to October 27th.
So moved by Ms. Yang. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Baker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The public hearing is continued to October 27th. And for the following item, the legislative hearing officer's recommendation is to refer to legislative hearing on November 9th. Item 42, RLH RR 21-62, 1514 Van Buren Avenue. And the motion is referred to legislative hearing November 9th.
All right, so moved by Ms. Jalali. Any discussion on that motion? Seeing none, roll call.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Baker,
Aye.
Prince,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The item is referred to the legislative hearing on November 9th.
All right. Thank you, Ms. Mormond. All right. That brings us to the end of our notorious October 20th agenda. Does anyone have news from the wards or things that they would like to share before we adjourn? I'm really sorry to say, I can't get this picture on my big screen, but it happens to be a picture of Chloe the sloth taking a tea bath today to celebrate International Sloth Day at Como Zoo and Conservatory. And if you are not on the Como Zoo and Conservatory social media accounts, please get on it because this is the most adorable picture. Not only is the sloth taking a tea bath, but it's eating while it's in the bathtub too. It's just a little irreverent. But International Sloth Day, I was wondering why my lock screen came up with a sloth on it, but we have a wonderful zoo and conservatory and they take wonderful care of our animals. And I just wanted to highlight those social media accounts. Like I said, if you're not on there, get on there. Because pretty much every day there's a picture that pops up that'll warm your heart. I see Ms. Jalali and then Ms. Prince.
I just wanted to share that I am just really grateful for the St. Paul Parks Department, who has put together so much good, just free community programming, especially with MEA weekend happening this weekend. But then through the fall, there's a lot of options for families if your kids are going to be out of school to just bring them to drop in or half day or full day programs across the St. Paul Park system. And then there's also a free screening of the movie Get Out this Friday at the Como Park Pavilion. And they're doing a whole ton of like spooky season things. There's just so many things to go to. And I just think that's so cool. And it's free and it's all through the St. Paul Park. So just representing my part of Como, but also wanting people to get out there and have a nice fall. Please just follow St. Paul Parks and see what's available to you, but encourage people to take advantage of this time. I know it's like a cold day, but we still have some nice weather. There's still some. So that's my news from the wards.
Sounds awesome. Ms. Prince.
And unfortunately, because I'm on a replacement computer today for technical reasons, I can't share my screen, but not this Saturday, but Saturday, October 30th, the Sunray Shopping Center, along with the Southeast Community Organization and Ramsey County 4-H, will be hosting Sunray Spooktacular from noon to 3 with treats for kids in costume, activities for kids, opportunity to meet your neighbors and build community, support Sunray businesses, live music with a DJ. But again, it is Saturday, October 30th, not this Saturday, and it's from 12 to 3. And please stay home if you're sick.
Very good PSA to wrap that one up. Any other news from the wards or comments from my colleagues before we wrap it up here today? All right, looks like none. Thank you folks for sharing, and thanks for a big day full of important stuff. I appreciate everyone's work, and there's nothing else to come before us. Therefore, we're adjourned.
Adios.